dyschromia. Yeah, liver spots, precancerous lesions, you've got to get rid of those. Now that's done with a facelift, so it's not done that on its own. There's been a mini lift and then resurfacing with plasma. Just plasma on its own. Hamster cheeks, as I call them. Yep. The backs of hands. Acne scars. So then we did this, well, I'll show that later, but I call it barcode. Usually from ladies who smoked a lot or so I'll flick through the bum first and just show you the pictures for now. So one treatment of 0.8 joules, so a very gentle treatment, no real downtime. So obviously the before is on the left on this picture and the after's on the right. I hope you can see that anyway. Depigmentation, skin type 4. 1 joule, 1 treatment. Took about a week to get to that stage, 1 week. Deep line in the centre of the nose. So it's only 12 shots, took about a minute. And this picture here is 7 days after. Very gentle closing of the pores. A lot of ladies like to tighten the pores up. I always apologise for this image, but it was in Pakistan. The ladies don't like to take the veils off and things. So we had to go around the back and she took the picture before and the picture afterwards. It swapped round a bit, so the after's on the left, the before is on the right. And there's still some flaking going on the forehead, I don't know if you can see it on the picture. If you look at the cheeks and under the eyes, it's still a little bit pink and new. So this is low energy stuff. This is Bernstein in America, and he's only shooting 0.5 joules. And he's doing a group of treatments, 3 to 5. And he's photographed this in one of these machines that they do for skin analysis, so he's getting the exact picture every time. Acne. Very, very good for active acne. That's 1 treatment. The name of the clinic's on there again, and they do have an active website, so you can see it on the website. Less progressive acne, but again 1 treatment. There was a study done on melasma. Melasma within Asian skin types can be quite difficult to treat. Doesn't really show up very well on the neck. The next picture shows up better, but this lady had it on the neck, which I've never seen before. Usually you get it on the face, like this one. So she's gone from that to that in 4 weeks. There's 3 treatments, 2 weeks apart. She's had the first treatment done, the second treatment. She's gone for the third and he's taken the picture. And it's done in conjunction with tranexamic acid, which is the replacement now for hydroquinone and things like that. Okay. Has everybody arrived or? Okay. Can everybody hear me? If I speak too quickly, I know I've got a different accent, just let me know and I'll slow down. Okay? Pardon? Pardon? Yeah. So obviously I work for Energist Medical Group, who are the manufacturers of these machines. We have, our headquarters is in Swansea in the UK. We did a recent purchase of a company called Chromogenics. I don't know if you've ever seen the eye lipo machines. We own all those now. We have an office in America, and obviously I run an office in Indonesia. I live in Jakarta. So we've got about, it goes up all the time, but we've got about 10,000 systems in the world in about 80 countries. And we've been operating since 1999. So today we're obviously talking about plasma. I'm not going to do too much on the technology. I hope I just do enough because I don't want to bore people and things like that. So plasma, you've got liquid, solid, gas, and then the next state of matter, the fourth state of matter, is plasma. So 90% of the universe is plasma. Okay? Now the easiest way to think of plasma, if you think of water, water's a liquid. If you freeze it, it becomes a solid. If you boil it or it vaporizes, it becomes a gas. And when the clouds are rubbing together with the wind, they create lightning, and lightning is plasma, or a form of plasma. We won't get into this technical thing too much, but plasma is a one-stage system. So we've got a gas. We ionize the gas in the system, so we're ionizing pure nitrogen. We're then firing the nitrogen plasma at the skin. The most important thing about that is because it's pure nitrogen, as we fire it at the skin under pressure, it purges the combustible gases from the treatment area. So it removes the oxygen, removes the hydrogen. Without oxygen, you can't burn anybody. You can't have a fire without oxygen. Yep. So you can put quite a high temperature into the skin without burning or charring the skin. And because we don't burn or char, we also don't ablate. It's non-ablative. Lasers are slightly different, aren't they? I mean, you've got a dye or a diode or a gas. They excite the molecules, it gives off its energy as light. We've excited the molecules, change that into light, and then we fire the light at the skin. Now lasers explode on the surface and seek out a chromophore in the skin subject to the wavelength of the laser. So like 600, 700 nanometers is looking for hemoglobin, etc., etc. Neogen is non-chromophore dependent. So if you had the worst face in the world with some acne here, you wanted to do a soft bleph around the eyes, believe it or not, yes, you've got a bit of atopic dermatitis over here, you can do it all in the one treatment at the same time. So how we're producing it. We've got the nitrogen gas, as I've said. We excite the molecules with UHF energy. So think of UHF, that's what your microwave uses at home. Ultra high frequency microwaves. We excite the molecules. As we press the button, a given amount of plasma is emitted from the handpiece. The more gas, the more energy you've got, the more gas is compressed into the handpiece, so the greater the energy and the greater the pressure. That's fired at the skin, so it's anything from 2.5 bar up to 4 bar, depending on the energy. Everybody okay with what bar is? 1 bar is the pressure of the atmospheric pressure. So because it's under pressure, it gets into the skin. It doesn't just go onto the top. I don't know if you ever played when you were a child, and if you squirt high pressure water at the skin, it gets under the skin. This does the same, this gets in. A very interesting thing. When you irradiate, and don't be frightened with that word, when you irradiate something with plasma, it opens a track into the skin. The reason it opens a track because you're firing that pure nitrogen into the skin, the body thinks it's lost its hydrogen and oxygen atoms, kids itself, so it wants to draw moisture in. So to draw moisture in, it opens this track. You put a topical onto the skin, so it could be a cosmeceutical such as vitamin C, it could be a antibacterial to do your acne, it could be tranexamic to do your melasma. It will draw it into the skin. That track remains open for about 24 hours and it closes down again. That's only at very low energy, 0.5, 0.6 joules. I mentioned this before. As we fire the plasma at the skin, it removes the oxygen, removes the substrate gases, so we produce this pure nitrogen area. And it's very easy to show this because skin not treated with plasma, skin treated with plasma, 1 drop of water. Where it's not treated, it sits on the top of the skin. Where it is treated, it sucks into the skin. Well, that will happen with any topical. Obviously, the thinner the topical, the better. This was a clinical study done in Japan. Gets a bit technical, so I won't go into it too much, but it was proven that nitrogen was the best one compared to the other gases. So we've all heard about Plexar and these corona discharge devices that fire a spark at you. Yeah? They're obviously ionizing the atmospheric gases, the air. This will never get into the skin because it's already changed back to its normal state before it gets anywhere near. Okay, argon, it's okay. There is some argon plasma devices. That's cold plasma. That will only do wound healing. It's no good for aesthetics. I believe there is one helium plasma system. I believe there is. Yes, those two are noble gases, so they're okay, they're not flammable, but they're not a good conductor because they're not positively charged. Yep. Just showing the skin again. When this was designed by its original company, Rytec, they designed it as an alternative to CO2, which was used by surgeons at the time for full resurfacing and for other work. So obviously they were very interested in the problems that it could cause, the complication rates from normal things. So against CO2 for hyperpigmentation, 25% of people at fractional CO2 get hyperpigmentation. 100% from full ablative. And then you've got to deal with the hyperpigmentation afterwards. 0.23% got it with Neogen. This is skin types 1 to 5. Hypopigmentation, the white marks, all the corona discharge devices create hyperpigmentation every time you use them. Every single time. We have a 0 occurrence. Bacterial infection, it's hot. Most bacteria dies before 50 degrees centigrade. It kills the bacteria. That's why it's good on acne even without a topical, because it kills the bacteria in the sebaceous gland. Fungal infection. If you can get the heat down into onychomycosis under the nail, which you can do with Neogen, you can kill the onychomycosis under the nail. Without any toxic drugs, without anything. Viral infection. It doesn't kill viruses, but people used to treat around the perioral region with lasers. People who had an occurrence of herpes, cold sores around the mouth, after laser treatment, it tended to stimulate those cold sores. Neogen doesn't do that. And finally, scarring. CO2 was used by doctors. There wasn't many scars happened. But obviously we had a lower rate again with Neogen. So as everybody's heard, there's 3 machines. There's the PSR machine. We tend to aim this at plastic surgeons. It's the machine we have to sell in America because it's got 6 protocols at the top. which are identical to the 6 indications covered by FDA. So button 1 will cover one, button 2 will cover the other, and it's requirement of the FDA. The last 2 buttons are extremely aggressive. One of them is triple shot, one of them is double shot, and button 6 is stuck at 4 joules. So you're looking 4 weeks downtime and upwards if you use that protocol. We have the Evo, the next machine. We aim this at dermatologists, aesthetic doctors. We have many GPs using this who've opened aesthetic clinics. This still gives you the same energy level as the PSR, but only single pulse. And it leaves you totally in control of what energy level you pick and what frequency you pick, instead of having these fixed programs. Then we have the SPA machine. Very low energy, very short pulse duration. Some therapists use this machine where they're allowed to in some countries. And it's still a revitalisation. I don't like the word rejuvenation. Revitalisation, because Neogen has been proven to thicken the skin rather than thin the skin like lasers does. We have some DNA sampling that's been done, and the stimulation of fibroblast growth hormone, vascular growth hormone and epidermal growth hormone is shown after use of Neogen. So we have the 3 machines. I don't know whether the hyperlink's working, but we'll give it a try. Yeah, it's worked. So let's talk about this machine because it's here. I'll run through it quickly so nobody gets bored. So we aim this at dermatologists and aesthetic doctors. Why do we do that? We mentioned the drug delivery before. So this will give you longer pulse durations at lower energy levels, which is better for the drug delivery. Obviously it's a medical device, it's CE'd. It comes with several options. You all get the 0.5 to 0.8 joules. Every machine comes with that. And then you get 2 other options. Some machines can just come with 1.5 joules, and some machines can come up to 4 joules. It depends on what you want. Yeah? It has frequencies from 1 to 2.5 hertz, and also has single pulse. Now, plasma was originally designed as a replacement for CO2, as we've said. The PSR version of plasma, it followed on from a system called Rytec Portrait, which was very aggressive, liked by some people, but within Asian skin type, they found it too aggressive. Asians wanted the machine, Asian doctors wanted the machine, so we ended up with the Evo, which gives them these more options. In terms of how that's sold, it's been out since September 2017, and it only sells in Asia really, and there's up to 280 now since that time. Maybe you can do with this machine, you can do the drug delivery, you can do low energy, multiple treatments with 0 downtime, so the ladies can come in and have a nice gentle treatment, go out with no downtime, come back 3 weeks later, do it again. And over a period of 3 treatments, maybe 4 treatments, depending on where you want to get to, they'll have a subtle but noticeable change in their appearance and the condition of the skin. If they want a single, wow, what have you done sort of treatment, equivalent to like a surgical treatment, you can turn the energy up and you can achieve that as well. So it gives you all the options. Now, so we talked about when we fire the plasma out, oh, that didn't slip off there. Fire the plasma at the skin and it creates an area of thermal damage. That diameter is about 7 millimeters, so one shot is 7 millimeters diameter of thermal damage. If you're only doing gentle treatments, you can use this diameter, which is 12 millimeters, so one shot is 12 millimeters. So you get an area of thermal damage, an area of thermal modification. So you can, an idea of 12 millimeter shots, you will do a full face, the whole skin, with 300 shots. you'll do a set of eyes, about 25 shots per eye. Okay? Energy level depicts depth, of course, of that thermal damage. So you notice on there, there's no mention of energy levels between 2 and 3 joules. So with all skin type, before 2 joules, you are down to the DE junction. So the whole of the old epidermis is going to flake off as the new epidermis is formed. When you get to 3 joules, you're down into the dermis. So the downtime is longer. We're on about the line of cleavage before. You're picking the treatment to the depth of the thing you need to remove or you need to improve. The trend nowadays, other than the US, where they're still very aggressive, the trend nowadays is to stay below 2 joules. Most people get an adequate result from that they're more than happy with. So what can we treat with it? There's things added to this every day and there's new clinical studies done. So as an aesthetic anti-aging, pore size reduction is your very gentle stuff. Fine lines and wrinkles you can do with multiple zero downtime treatments. Get to the deeper right eye, you can still do with the lower energy, but maybe turned up a little bit to 0.8, maybe double pass. Or you can go above 1 joule and start using more energy. Superficial pigmentation, obviously you're flaking the skin off. We did a gentleman's hands today, they already dried up because he had lots of pigmentation on the back of his hands. You can treat around the eye. It's not a light source, so you can do the whole of the eyelid, right up to the hairline of the brow, and right up to the brow, right down to the eyelash, and up to the lower eyelash. So unlike the corona discharge where you just burn the line, we're doing the whole architecture. Okay? Skin tightening. Some of the pictures showed you how it's tightening the skin. Stretch marks. Now, it's great for new stretch marks. Stretch marks where the lady's had the baby, 6 months later she's lost the weight, they've not discoloured too much, they're still white, you know. But those stretch marks it will do adequately on its own. Very, very well. If they're a little bit older, if you've got a fractional device, use it in combination with that fractional device. Use the fractional device first and then use Neogen to improve the tone and texture. Acne scars. I put Asian skin type there because I have to cover myself for the US. The US one has this specific program. This will do acne scars just as well. But if an American doctor sees that, he wants to know why he's bought this machine with this program 6, etc. Medical drug delivery. So active acne, as we've already shown, melasma, atopic dermatitis, psoriasis, actinic keratosis, which is a big thing here, the sun mark, onychomycosis, you don't need any topical. We've got doctors now doing burns revisions, so these people who've ended up with a big red mark over the face where they burnt half the face. We've got doctors in Japan called Fujimoto working on the burns and improving tone and texture through a lot of gentle treatments. He's also doing skin grafts, where the skin graft looks different, and he's also treating those very gently over a big period to improve the tone and texture of those. And then we've got the oral infection, which we've mentioned. It's gingivitis, it's brilliant at gingivitis. It does whiten teeth. We don't sell it to whiten teeth, but it does whiten teeth very well. We can go through that again, but 0.5 to 0.8, yes, rejuvenation, but it's more than that. It's revitalisation, it's thickening the skin. Above 1 joule, it can become a resurfacing tool, a deep pigmenting tool, deeper itides and acne scars. Won't go too much into that. So 1 joule and above, what can it do? Right, so I can't read it from here, so I'll do it here. At these energy levels, the Neogen is proven for the treatments of acne scars, deeper right-eyed, actinic keratosis, viral papillomator, seborrheic keratosis. It will do all that. It's great for around the eyes because you don't need ocular guards. You can tighten the eyelid up, you can remove the eye bag, the crow's feet, remove the looseness in the eyelid, and you can get quite a bit of lift. We've averaged 4 millimeters per treatment of lift. Full face resurfacing if you want to do it, but full face resurfacing without ablating. So denature the outer layer of the skin, patient will go home, day 4 it will bronze off, day 5 or 6 it will start to peel off, day 7 should be all finished. And then you will have a full resurface of the skin. Depigmentation we've already mentioned. Treatments to improve acne scars. It's very, very good at acne scars. Very good. And it's very, with the Chinese, and we've got the CFDA in China, the clinical study that you have to do in China to get CFDA, they used acne scars. So they did acne scars on Chinese skin type. Worked very well. You can use it in conjunction with other things. So we have plastic surgeons in America doing a facelift using this straight afterwards. You can use it in conjunction with threading. You can do the thread and do this immediately after because it will tighten the skin around the threading. You can do Botox and do this immediately after. You can't use it with fillers immediately after, it will denature the filler, make the filler hard and lumpy. So if a patient's got fillers, you need to wait 3 or 4 weeks later. Okay? So we've been through these pictures for most people, we'll go through them again. So 0.8 joules, single treatment. The lady's 60, 62. She's Dr. Kelvin's wife in Singapore. Depigmentation, nasal line, pores. I mentioned the Pakistani lady and I apologise for the pictures. Gentle treatments, 3 to 5 gentle treatments around the eyes. Acne. What they find is with acne, within 3 treatments, most people are in a managed state. Doesn't mean you have to stop treating them, it just means you're managing it. So then you're bringing them back and probably spacing those gaps out until the acne is, the hormones have changed and the acne is no longer developing. So once you get somebody started, really, you should have a continuous revenue. The people who stop doing it, the acne soon comes back, so they will come back. And the beauty of this is, you can also treat the acne scars. So not only can you help them with the acne, you can help them with the acne scars that the acne has caused. More acne. And then this melasma, which doesn't show up well in the neck there, but did show up quite well there. So, we believe this machine is perfect for dermatologists and aesthetic doctors. You can irradiate for drug absorption with low energy. You can use low energy for anti-aging treatments with 0 downtime. You can use higher energy if you want to do that in one treatment, or you need to create a more significant result because the patient may be older or maybe need more attention. At these lower energies, so below 1 joule, you don't need any pain relief whatsoever. 1 joule to 1.8 joules, a good topical will do. If you are going to do 3 joules and above, you're into nerve block. I'm sorry I rushed through it, but I didn't want to get people wondering what we're saying. Any questions? It will fade them, and if you did that with glutamycin, so if you added glutamycin immediately after, so that will help the birthmark. I would imagine tranexamic acid would as well. I don't think you get it to a stage where people wouldn't see it anymore. Okay? A lot of people nowadays don't want any downtime. So the trend tends to be multiple treatments. Yeah? And people always ask, how often are you bringing them in? Right? You can do it after 2 weeks, you can do it after 3 weeks, but people tend to come once a month. They get paid once a month, they tend to come once a month. It works fine at that. Yeah. The beauty of that, they can even have it done at dinner time. They can come out of work, have it done, go back to work. Nobody knows really they've had anything done until several treatments later, several weeks later, everybody's going, wow, what have you done, sort of thing. If people accept the downtime, you can show your progression pictures, so what happens through the downtime, and as long as they accept that, that's fine. You can give them the option. Yeah? Any more questions?
Does it work on fat, dissolving the fat?
Well, it warms the fat, and then if you warm the fat and manipulate the fat after, so you could, if you did that and then use some sort of sauna device, ultrasound device, it would help you. And we have found, when you got the fat in the eye bag and in the eyelid, that does seem to improve that significantly on its own. Good point. So, there's lots of devices in the market now that call themselves plasma. They tend to be in 2 groups. The first group is corona discharge. So you get all these that look like a pen or a remote off your television, and they've got a little fine metal tip. They earth the patient on the bed, and then they create an arc from the pen to the patient. The spot size tends to be less than 1 millimetre. Yeah? And they tend, if you've got the crow's feet, they tend to put the dots on the crow's feet. You've probably all seen them. They all burn you because it's arcing within the atmospheric gases. And the only plasma that's actually involved in that treatment, as the arc comes to the body, it ionises the gases in the atmosphere. They're at atmospheric pressure, so it's ionising the oxygen and the hydrogen and everything else, but that just gets absorbed back into the atmosphere. The actual plasma is not entering the body at all. They're able to call it plasma because lightning is plasma and it looks like lightning. We were looking at some the other day that were calling themselves plasma, and they were actually RF devices with nothing to do with plasma. Yeah? But they, again, had the arc. Then there's gas plasma systems. So we have a pure gas on the machine, which can be, it always has to be an inert or a noble gas. Can't be a combustible gas. Yeah? So there's argon, which is cold plasma. This is great for wound healing. So if you've got somebody with diabetic leg ulcer and you're treating lots of those patients, argon plasma will help wound those ulcers. Neogen will stop those ulcers spreading because if you go around the outside of the ulcer, it will stop the bacteria spreading. You know, the red fiery bit around the edge of the ulcer, but you can't treat the ulcer itself. So that's argon one. There is one machine out there that's helium. Helium, yes, it works. It works. It's a little bit slower than nitrogen. It's not readily available like nitrogen, so consequently the gas costs a lot more. Yeah? The speed at which it works is very, very slow. And they're okay, don't get me wrong, you can use them, but you're going to need an awful lot more treatments and it's going to cost you an awful lot more money than using nitrogen. Yep. So that's the different plasma devices.
Have you got a
Picture of the burn effect? I don't really like to, I don't like to show that because then I'm sort of downing people's technology.
Well, just to,
Yeah.
side by side.
So the corona discharge devices, the ones that are spark, the first one was Plexar, yeah, which is an Italian one. Everybody's probably heard of Plexar. It's classed as an electromedical device, electrosurgical device, and its only approval is to removal of skin tags. And then people then used it for other things. Now, if you've got somebody with a black tattoo, you know, the black where they've handwritten it or put the blue cross on their hand, it's great at removing them. Really good at doing that. And it's good at removing skin tags. As an aesthetic device, it's a little bit too slow. You can only do small areas. Anything above skin type 1 and 2 is going to suffer with hyperpigmentation from it. Let me find the pictures you wanted.
So what about body areas like stretch marks and things like that?
So new stretch marks from ladies who've had the baby, 6 months later lost the weight, and they want to get rid of them. It's great on its own. I can find some pictures of that for you. The older stretch marks, it will still improve them. Whether it will give you the improval percentage that a patient would be happy with on its own is debatable. But if you've got a fractional device, if you drill the holes in them first 3 or 4 times over several weeks, then use Neogen after, you can get a good end result. Now the fractional device won't work on its own because the tone and texture of it is never any good when they treat a stretch mark with it. Okay?
Neogen Evo, is this doctor only operated or can nurses or therapists use it?
It varies from country to country. Within most Asian countries, only doctors can use it. In some countries, therapists can use it, yeah.
Do you know about here?
I believe they can here. They definitely can in New Zealand. I believe they can here.
There's a regulation that
Yeah.
stops you from using it.
And what happens is on the device actually has 2 different sections. So it could be one section you can call the nurse or aesthetic, therapist, and the left section could be the medical, the doctor. And you actually have individual passwords. So let's say like if you're a clinic and you do not want to have the nurse have access to the higher settings, it's a completely different entering number, which not necessarily need to be passed on to that person who should not have access to the higher settings. And in that case, your maximum output is going to be 1.5, and that's it, no more. And you have another section where it's like you're just entering before the machine gets activated, and you just put your code in there, and that will activate the lower energies. So it's very advanced, and it's really can be used on whatever you need.
Perfect.
Yeah,
Really,
but as
5
you would be an
minutes, lots of
esthetician,
pictures.
you don't want to use it any higher. I'm telling you, the highest you probably would go is the 1.5, and you need to use numbing cream at that. And the other one, for the doctors, they use over the 3 joule, and for that one you really need to have a
The nerve blocker.
you need So definitely a nurse you would not use anything. Yeah,
I had a
definitely.
treatment today.
Today was about anything from 0.5 to 0.8.
0.8. Yeah.
And as Dee said, what you say was about a 1 out of 10. I'm a guy, so for me it was a 2 out of 10.
Sounds great.
More like
It's surprising that, and you're more than